Hello, this is Esomeprazole, and today we are going to be learning about knee.
We are Esomeprazole. We have a generic name of Esomeprazole magnesium, having brand names of Nexium and Nexium 24R. Nexium 24R is indicated to adults having frequent heartburn, while Nexium is indicated to many acid-related conditions. We have a chemical name of magnesium 5-methoxy 2,4-methoxy-3,5-dimethylpyridine 2,1-methylsulfonyl benzamidazole 1-ide trihydrate. My partner is up next to discuss our drug classification, pregnancy category, and mechanism of action.
Now let's proceed to our drug classifications. Our therapeutic drug classification is anti-ulcer agent. It lowers acid production in the stomach, which prevents ulcer. It also prevents gastric damage from the use of non-steroidal anti-inflammatory drugs. Our pharmacologic drug classification is proton pump inhibitor. It suppresses gastric acid secretion by specifically inhibiting the hydrogen-potassium adenosine triphosphate enzyme system on the secretory surface of the gastric parietal cells. Let's talk about our pregnancy category. Are we safe to be taken by pregnant women? The answer is yes. We belong to pregnancy category B, which means that animals with reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women. Next up, our mechanism of action. Esomeprazole works by blocking the enzyme in the wall of the stomach that produces acid. By blocking the enzyme, the production of acid is decreased, and this allows the stomach and esophagus to heal.
Thank you, partner, for discussing those. Now I'm back to tackle about our pharmacokinetics. We are administered orally as enteric-coated granules and rapidly absorbed, with peak plasma levels occurring approximately 1 to 2 hours after dose. Our absolute bioavailability is 64% after a single dose of 40 milligrams and increases to 89% after repeated once-daily administration. It is also important to remember that food intake both delays and decreases our absorption. For our distribution, we are 97% plasma protein bound. Then we are extensively metabolized in the liver by the enzyme cytochrome P450. And now for our excretion, we are eliminated in the urine by 80% and 20% in the feces. Our plasma elimination half-life is approximately 1 to 1.5 hours.
Get to know us more by knowing when you should use us and when you shouldn't. Here is our indications and contraindications. First, let's start with our indications. We are indicated to be used for frequent heartburn, hepatic impairment, gastroesophageal reflux disease with erosive esophagitis ulcers, and persistent cough. Let's go to our contraindications. The following conditions are contraindicated with this drug: inadequate vitamin B12, osteoporosis, systemic lupus erythematosus, diarrhea from an infection with Clostridium difficile bacteria, severe liver disease, allergies to proton pump inhibitors, and patient 18 years old and below.
Now let's head on to our side and adverse effects. To the central nervous system, we may cause nervousness. To the cardiovascular system, we may cause abnormal heartbeat. While in the muscular system, weakness, leg cramps, and muscle pain can be expected. Also, with long-term use, we may increase the risk of Clostridium difficile infection and osteoporosis-related fractures of the hip, wrist, or spine. Therefore, it is important to use the lowest doses and shortest duration of treatment necessary for the condition being treated.
The nursing responsibilities. Before administering esomeprazole, the nurse must first assess epigastric or abdominal pain, question history of hepatic impairment and pathologic bone fractures, evaluate for therapeutic response, question if GI discomfort, nausea, and diarrhea occur, monitor for occult blood, observe for hemorrhage in patients with peptic ulcer. Inspect the skin for lesions, rash, pruritus, and dryness to identify possible adverse effects. Assess respiratory rate and rhythm. Note evidence of cough, hoarseness, and epistaxis to monitor for potential adverse effects of the drug. Assess for neurological status including level of orientation, affect, and reflexes to evaluate for CNS effects of the drug. During administration, the nurse must administer the drug appropriately before meals to ensure that the patient does not open, chew, or crush capsules. They should be swallowed whole to ensure the therapeutic efficacy of the drug. Ensure safety and comfort. Institute a bowel program. Monitor nutritional status. Ensure follow-up. Provide patient support and educate the patient. After the administration of esomeprazole, the nurse must monitor patient response to the drug, including relief of GI symptoms caused by hyperacidity and healing of erosive GI lesions. Monitor for adverse effects including GI effects, CNS changes, dermatological effects, and respiratory effects. Monitor the effectiveness of comfort and safety measures and compliance with the regimen. Lastly, evaluate the effectiveness of the teaching plan. And that's it for esomeprazole. Bye-bye! Hi, I'm Lansoprazole, and today you're going to know more about me.
Hi there! Lansoprazole is our name, and it is our generic name. We have brand names of Prevacid, Prevacid Solutab, and Prevacid 24HR. This is our chemical name.
Welcome to my drug classification. Just like esomeprazole, my therapeutic drug classification is anti-ulcer agent and my pharmacologic drug classification is proton pump inhibitor. Moving on, let's now talk about my pregnancy category. They said that they cannot cause fetal harm, but I have limited research on human pregnancies. Any guess as to what my pregnancy category is? Right, it's pregnancy category B. Now I'm gonna tell you my mechanism of action. As a proton pump inhibitor, I am a prodrug and requires protonation via an acidic environment to become activated. Once protonated, I am able to react with cysteine residues on parietal hydrogen potassium ATPase, resulting in stable disulfides. As PPIs, in general, we are able to provide prolonged inhibition of acid secretion due to our ability to bind covalently to our target.
Yes, partner. Thank you so much. Now let's head on to our pharmacokinetics. We are rapidly absorbed from the gastrointestinal tract, but food delays absorption and reduces our bioavailability of approximately 50 to 70%. And our time to peak plasma concentration is about 1.5 to 2 hours. Our plasma protein binding is approximately 97%, and our volume of distribution is about 15.7 liters. As for our metabolism, we are extensively metabolized in the liver via hydroxylation, primarily by CYP2C19 isoenzyme, which inactivates 5-hydroxylansoprazole, and a lesser extent of CYP3A4 isoenzyme, thus in turn inactivates lansoprazole sulfone. Lastly, we are mainly excreted via feces by 67% and 33% in the urine. 14 to 25% remain as metabolites, and our elimination half-life is about 1 to 2 hours.
We are now going to talk about my indications and contraindications, starting with my indication. I am medicated for the short treatment of active duodenal ulcer, short-term treatment of erosive esophagitis, long-term treatment of pathologic hypersecretory conditions including Zollinger-Ellison syndrome, maintenance of healed duodenal ulcer or erosive esophagitis, short-term treatment of gastric ulcer, short-term treatment of symptomatic gastroesophageal reflux disease, Helicobacter pylori eradication to reduce risk of duodenal ulcer reoccurrence, treatment of non-steroidal anti-inflammatory drug-related ulcer in patients who continue to take non-steroidal anti-inflammatory drugs, reduction in risk of non-steroidal anti-inflammatory drug-related ulcer in patients who have history of gastric ulcer but who need non-steroidal anti-inflammatory drugs. For my contraindications, I am contraindicated for the following conditions. Check with your physician if you have any of the following: diarrhea from an infection with Clostridium difficile bacteria, inadequate vitamin B12, low amount of magnesium in the blood, severe liver disease, interstitial nephritis, osteoporosis, a condition of weak bones, broken bone, and hypersensitivity to proton pump inhibitors. Let's proceed to my side and adverse effects. My side and adverse effects on the digestive system includes diarrhea, nausea, abdominal pain, constipation, and vomiting. For the cardiovascular system, I have chest pain and irregular heart rate. In the muscular system, we have muscle pain. In the nervous system, we have headache, insomnia, vertigo, and dizziness. In the respiratory system, we have upper respiratory infection and cough.
Nursing responsibilities. Before administering us to the patient, the nurse must perform history taking and physical examination that include assessment of possible contraindications and cautions involving history of allergy to a proton pump inhibitor, which is S, to reduce the risk of hypersensitivity reaction, and current status of pregnancy or lactation because of the potential adverse effects on the fetus or the nursing baby. Also, the nurse must monitor CBC, hepatic or renal function test, and assess for therapeutic response. Lastly, the nurse must obtain C-difficult PCR test in consideration with persistent diarrhea, fever, and abdominal pain. Then the responsibilities of the nurse during is monitoring the patient response to the drug. For example, relief of GI symptoms caused by hyperacidity and healing of erosive GI lesions. Next is monitoring for adverse effects and the effectiveness of comfort and safety measures. As for the nursing responsibilities after, the nurse must conduct patient or family teaching. Then, evaluate the effectiveness of the teaching plan for which the patient can name the drug and dosage and describe adverse effects to watch for. That's all for the nursing responsibilities.
That is all from Esomeprazole and Lansoprazole. Thank you. Bye-bye.